So let's see. Oh, we are on. Welcome everybody to this week's episode of Weekly Dose with Dr. Ude. It's going to be lit today. I am so excited. We were just talking before we got started. We're going to be giving a lot of information on autism. I have Dr. Lola here with us. So I'm going to start with the introductions and then we're going to go right into it. So for those that don't know me, my name is Dr. Ude. I am a board certified family medicine physician. I am based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine. I also provide aesthetic services for my patients and clients. And with both modalities, my goal is to have my patients not only feeling good, but looking good. So now on the flip side, I'm going to let Dr. Lola introduce herself, and then we're going to get right into this. So Dr. Lola, thank you so much for coming, for being here. I know you have a busy schedule. Welcome, welcome. So if you can introduce yourself.
Thanks for having me, Dr. Ude. It's such a pleasure. I mean, when I got the invite, I was like, wow, okay, I think this is one. I've spoken on different platforms, but there's always a difference every time. I'm very grateful. Good day, everyone. So my name is Dr. Lola Okeowo. I'm a trained MD. I wear a lot of hats. I'm a trained MD. I'm trained in functional medicine, nutrition, holistic medicine, behavior analysis. I'm actually trained behavior analyst. So, and I'm the founder of Autism Renewed. So, Autism Renewed is an online consulting practice. So, what I do with Autism Renewed is I coach and I support parents of children with speech delay and autism. So, what I do is that I coach them on how to help their children navigate developmental challenges and to thrive. I believe in putting the power in the hand of parents because I believe that an informed and empowered parent becomes a parenting advantage to help their child navigate any developmental challenge and for the child to thrive. So aside autism or health, there are so many other things I'm passionate about. I'm passionate about personal development, so I coach people in understanding seasons of life, on how to embrace their seasons, how to identify patterns, unleash potentials, and fulfill purpose. Then also I'm passionate about tech. So I am passionate about tech. So I help professionals, to transition into tech using your current skills and experience. Because I believe that everyone needs to get into tech, and
Absolutely.
embrace tech one way or the other. So
So
that's
doing.
another thing I'm so passionate about. So thanks for
Awesome.
having me, and it's good to be here.
So I think we're gonna be probably having some part one, part two. So it's gonna be developing. We're gonna have to do some more further interviews. But so this time we're gonna focus on autism. So how did you get into what you do now with autism and coaching and helping?
Okay, looking back to why I studied medicine, I've always been passionate about changing lives, but more in a transformative way. Okay. And of course, I remember, growing up, I used to be passionate about, I used to be, how do I put it? I used to be kind of inquisitive. I like change. I don't like just manage something, if you know
Mhm.
what I mean. So, of course, I used to be passionate about nutrition, diet, and things like that. So I think, I'm a learner. I like to read, I like to study, and I know that science is progressive. So I like to, when I hear new things, new discoveries, I always like, okay, wow, this. So along the line, I'll see a lot of things in mainstream that we are taught or trained to say nothing can be done. But somehow I'll see, when the whole diet lifestyle things that pop coming up and all that. And I'm like, okay, but this is what I know, or this is what I've been trained in. What this is saying is how true is it? Of course, I know that a lot of people who are say a lot of things that are not true. But somehow, I don't know if you know Dr. Terry Wall, she's a neurologist. And I saw her, someone on her story. She was diagnosed with multiple sclerosis. And of course, we know multiple sclerosis, no cure. And she was a consultant neurologist and she was sent home to die because, she had gotten to the end. She couldn't walk, nothing. And she said somehow when she got home, I don't know, she stumbled on making dietary changes, lifestyle changes. And within 6 months, she was not only off the wheelchair, she actually was able to compete in the marathon.
Wow.
And so that began the quest for me to see beyond the norm,
I see.
not just embrace something and run with it, no, but to say, okay, yes, we've been taught this, but sometimes science is progressive. The scurvy years ago did not have a treatment. People were dying of scurvy, but today people are, so along the line. So that was when, I also stumbled on the children with developmental issues and things like that. And I began to see a gap. Of course, medical training, we're not, you don't really go in depth into some of these things. You were taught, but, not so much, because sometimes when we see conditions and we think that there's nothing, there's a perspective that somehow, whether I like it or not, as a mainstream doctor, you already have. But I began to see some other perspective to it of people who are, you know, able to thrive despite this. So it got my attention. And what got me was my core passion of going into medicine to be able to feel a need and transform lives. I realized that when it came to developmental issues, there was a gap. And there was a gap that was determining the difference in the outcomes of how kids were thriving. So that was that, I mean, the whole journey of, discovering. Then the more I researched, I know, being a doctor, you would like to read
That's
and
it
everything.
now.
So the more I researched,
Like to learn.
I found it interesting. And for
Mhm,
me, the fact that I can take someone on a journey of transformation
mhm, mhm,
and not just accept the norm, for me, that fulfillment, is what made me, embrace what I do. Do you understand? Because I just felt, I got to a point where doing the norm was not fulfilling enough for me, the same old. And somehow I just felt that I wasn't giving my patients the best.
mhm,
I'm sorry to say, I felt like I was just doing what I was told,
mm,
trying to play safe. Oh, you don't want to get in trouble. This is
mm,
what the board says. Yes, I
mhm,
know that all those things are there for regulation, which I don't have anything against, but personally, you
mm,
know, as a person, I wasn't finding that fulfillment. The core of why I came into medicine, that
mhm,
wasn't fulfilling it for me. But when I discovered that I could actually do this and have that, I was, I mean, the more I read it, the more I would read this, the more I would be so excited about it. The more I would be, I could feel it. Even though, yes, it doesn't look like the conventional path, it
mhm.
doesn't look cute. You know what I mean? It takes a lot to be able to step out and but I was finding fulfillment. And I
Wow.
just felt, no, I think that I would like to do this, and transform life. So
So you found a way basically to empower your patients. So when you have, I guess, to take a deeper dive on, if you see, when you see a patient that is diagnosed with autism and you're meeting that family and parent and child for the first time, how do you go about helping them?
okay. So how I go about helping is this. Like, I don't work with the children. I
Mm-hmm,
work with the parents. So sometimes you have a mix of people. Some people already have a diagnosis, but
mm-hmm.
sometimes you just, or most of the time, no, I won't say most of the time, sometimes you just have a concerned parent.
Right.
Because another thing I came to realize is that you have two groups of people. Some people who don't, sometimes when you put on the label, some parents, people will just run away and just feel like, oh no, my child, it doesn't have this. Because another thing is that when it comes to autism or any developmental challenge, that's why they say it's a spectrum. So no picture is really the same. So sometimes it's different. Some children are verbal, some children are not verbal, some children have behavioral issues, some don't have behavioral issues. So I have a mix. Sometimes you just have a concerned parent. And what I've been able to do is to help parents demystify the concept of the diagnosis. Because for me, the diagnosis is not the primary thing. Because you even have some children who do not meet the criteria of the diagnosis, but yet the child has a challenge. So my
Right.
concept is, if a child has a challenge and a child needs help or intervention, the diagnosis should not be the factor.
Mm,
Because when it comes to making a diagnosis, you're just doing an assessment. Okay, based on this, does child have 3 points, 2 points? And 3 points might be the marker for a diagnosis. What if a child has 1 or 2 points? The child is still struggling. So for me, when I meet a parent,
mm,
I first of all, yeah, sometimes when they give the diagnosis, it just maybe say they've already done an assessment, they have a diagnosis. The diagnosis does not determine the management or treatment because, like no two kids are the same.
right.
So when I meet a parent, I individualize what is going on. So whether or not they have a diagnosis, whether or not they don't, the truth is, what are the areas that your child is struggling with? So most of the time you have speech, you have social issues, you could have behavioral issues, sometimes you could have nutrition, because there's so many other things that are intertwined. It could be academics, it could be, or sometimes a child just has speech issue, because I watch the children also with speech delay, not necessarily now have a diagnosis of autism. So the concept of supporting them is not based around the diagnosis
Right.
for me. Because, okay, you do an assessment, you give a child a diagnosis, now what? You send them to therapy, speech therapy, but speech therapy is not speech therapy, because even speech therapy will be dependent on what the child is going. Is it a receptive language issue? Is it an expressive language issue? Is it an articulation issue? Is it comprehension issue? So there's no one size fits all. So what I do is to break down what is going on, what areas is your child struggling with. I don't have a problem with saying you want to go, if you have an assessment, you want to do an assessment, because it's an online consulting practice. So of course, I don't do a physical, what do you call it? Examination. But the parent knows the child, okay, the child is struggling with, expressing themselves. The child is unable to write. The child is, so most of the things you already know, you can
So yes.
identify. If there are things that you need I need a detailed maybe medical history or health things, you can tell, okay, do you have a medical sub most of the time? Because parents, especially mothers, they know what is wrong with the child, and most of the time it's not something they didn't just start yesterday, so they can give you the whole history of where have you started, how it's progressed. So and by the time you understand this, you already know what's going on. And you already know, okay, these are the areas that the child needs to be supported. So there also could be nutritional things, or of course, I don't prescribe. If there are acute things that you need to see your primary care physician for, you see them. So that's how I work with them. So what I now do is to partner with the parent and coach the parent. So part of my coaching also is not even just um, talking about concepts of therapy or things to do with the child. Also to coach the mom on how to navigate the team she's working with. Some parents don't know how to pick the right school for the child, because the environment that the child is in, both the home environment and school and other things that you're accessing, is also a huge factor. I've had clients who their child was struggling with speech and language. And by the time we finished the session, the parent realized that the child was in the wrong school. And the decision they needed to change the school. It doesn't mean that the school is a bad school. That the school is a good school may not mean the right school for your child. So that's why, you see why I keep saying the parent is the core.
Right.
So the mom realized that the child was in the wrong school. They changed the school of the child and changed some things in the environment, enrich the environment. These are some of the things that I teach parents, how to create an enriching and supporting environment to help some of those things. Your child is having sensory issues, hypersensitivity to sound. Sometimes it could be some things in the environment that are, stimulating some of those things, screens, other things like that. And the child picked up. So you can go for therapy. If the mom comes home and is not implementing some things, it's kind of like it's kind of like what the professionals are doing wouldn't work. So that's part of what I do, not necessarily sit down with the child, because I know that I'm not against whether you're getting therapy or not, but how to even maximize, if currently they have professionals, how to maximize some of those things, how to partner effectively with them, because those are the things that would help the child to thrive. Because sometimes I have clients who come and say, okay, they're having speech therapy. What are they doing? I don't know. What are the goals? You don't know. What are they working? You can't say that. You're not going to see anything. They just come to, you don't understand what they're doing. You don't know where they are. You don't know what working toward. That's not effective. You need to be able to be the core, to partner with these people. How are you sure therapy is effective? You don't know. Things like that. So that's how I work with them, in all those, areas. Examine what they're doing, what they currently have, and support them and empower them the right information to be able to create that environment, create those resources, and support their child in journey to thriving. Yeah.
That sounds amazing. So, the other thing I would ask is, so for anybody listening out there that has a child that is autistic, parent that's listening, are there any actionable, simple, actionable tips that you can give them to get them started on their journey, to help them to move forward?
Okay, actionable steps is first of all is creating an enriching environment.
Okay.
That's very, very important. So of course, it depends on, like I said, the areas that the child is struggling with. So that's why most times you have to individualize the area. So if you have a child with a lot of behavioral issues, okay, maybe head banging, the thing is that you have to identify the function of the behavior. Every behavior is a communication.
Gotcha.
So and you need for you to be able to address it, you have to understand what the child is trying to communicate. And sometimes if a child has language delay or is challenging communicating, they would they have a tendency to be aggressive. You just know, just like for example, people that have hearing impairment, sometimes you notice they can be a bit aggressive if they're trying
Mm,
to communicate with you. They have a bit of hearing um, challenge with their I mean, real core ones. You notice that when they're trying to talk to you and you don't get them, they can get a bit agitated. So depends on that. So for example, if it's a behavioral thing, if
mhm,
it's even a language or whatever, your environment, how enriching is your environment to
mhm,
support the child? When I'm talking about enriching, there are things you may need to examine, to remove, the things to replace, to readjust. Okay,
mm,
like I said, for example, I'll give an example. It's a behavioral thing. You have to
mm,
identify what is the function of the behavior, what is the child trying to communicate. Every behavior is a communication. It could be
mhm,
for attention, could be for attention, because remember, any attention is good attention. So whether
mm,
they get you to shout and yell, every attention is better than no attention for children. So you have to identify that. Or it could be pain, it could be discomfort. So sometimes things like constipation,
mm,
because a lot of children tend to have, GI issues, constipation, and so they
mm,
could be in pain. So those are the things to look out for the child, or grabbing the tummy, those kind of things. It could be headache that the child is having. So those kind of things, it could be that, or it could be sensory issues,
mm,
and hypersensitivity to sound. And the funny thing with sound is not the typical sound that you and I are sensitive to. As
mhm,
simple as the child can be hearing, some children can be so sensitive, they can hear the buzzing of the Wi-Fi of your phone to that detail. You'll be
mm,
surprised. They can hear the humming of your refrigerator. To them, can be so loud, but to you, it's just normal. So it could be the sound. It could be, so you have to identify that. So what I'm going to tell the parents is to examine the environment, individualize what is going on. Okay, and make sure your environment is enriching to support the child. Okay, what kind of things do you have in your environment? What kind of resources do you have? Toys, books, those kind of things. Play. I always say that play is a tool to
mhm.
teach and build skills. Parents will say, my child plays too much. My child is restless. If you find yourself saying that as a parent, just know that you're just speaking from a place of ignorance. There is nothing like a child plays too much.
That's right.
Play is a tool. You only need to know how to use it. So those are the kind of things. How enriching is your environment for that child?
Absolutely.
Another thing is that I would advise you to examine your screen, the whole screen thing. I mean,
Mm,
is your child exposed to a lot of screen? So those are some of the things you may need to, begin to adjust. But you need to sit down and do a more work with detecting, to study for example, a child that is having behavioral issues. Try to study when the child starts in the last 1 hour. What are the things that happened? What changed? Was there a drastic change in the environment? Did the music come up? Was it the light that came up? Try to find out what really happened in that 1 hour. So if it's consistent, you may be able to pick, you understand, what happened. What is there a time of the day? Is there an event? Is there something, that happens? You're able to pick it and you're able to adjust. Because for you to modify the behavior, then you must be able to find the antecedent. That means what is precipitating it, so that you can
right.
able to modify. So what I would tell any parent is examine your environment, ensure that you're creating an enriching and supportive environment for
Mhm,
your child. So if it's so that you're able to, because you need to able to reduce some things so that some things would increase. So even if you are doing therapy, things like behavioral issues, some other things may be impeding the ability for the therapy to work, because therapy is like you're training someone. So imagine you are in a stadium and there's so much noise and I'm talking to you. I'm trying to get you to hear and learn. You can't learn because there's so much noise.
Distracted, yeah.
So what I want to tell the parent is to sit down, identify the areas of challenges, and begin to see how you create the environment or the things that are precipitating to adjust it to be able to support your child. Of course, that does not negate professional help or involvement. And another thing is that if you're a parent and you already have professionals that you're working with, ensure you're partnering correctly with them to find out where you are and understand. You don't have to be a professional, but you must understand what is going on. Ask questions in a very respectful way, because some parents can just come about and pay money. What are they doing? No, not that way. Partner with them.
Gotcha.
Partner with them so that they're able to, help you, talk to you, and carry you along, and even train you on how you can begin to implement some of the things they are doing into everyday life. That is when you begin. So when you begin to do all that, all the other areas that there are gaps that you still need to fill in, then you now know how and what you would need to fill in those areas.
Absolutely. That is really, really, really good advice. So the other thing, I think at the beginning we talked about how you got into what you do now. The other question I usually ask, which is more about you, is with all the experiences that you've had, all the life that you've lived so far, if you got an opportunity to meet your 20-year-old self, what would you tell them? What would you advise them? It's a
Hmm.
loaded question,
If
obviously.
I had if I had to meet my 20-year-old self,
Mhm.
I think that um what I would tell them is to um focus on life skills, build life skills. My 20-year-old self, I'll focus on building life skills. I would get
Mhm.
a mentor. I would plug into an accountability system.
Mhm.
I would find someone who is where I want to be, and I'll
Mhm.
find that person and
Mhm.
get them to mentor me. Because I
Acts.
realized that a lot of things that, I kind of had it in me, but somehow there was no structure or no one to help. You have passion for something, you like this, you want to do this, you have intentions, but intentions are not enough. So now I'm getting to a point in my life where I'm accessing some of those things. And I
Mhm.
realized that if I had those things, if I had the right mentors, then if I
Absolutely.
had the right systems, if I had
Absolutely.
the right environment, both physical and environment is not just physical. If I had that, I think that would have, you know, I think I'll be in a different place.
That's it.
Honestly, yeah, I think
That's
that's
it.
what I'll tell
I,
myself.
I I agree with you in the sense that you would get there eventually, but when you talk to and communicate and you're in community with people that are, interested in what you're interested in, especially if you get a mentor that is where you want to be and has done it, it usually makes it so much easier and faster. And that I totally agree with that. That makes so much sense. I always ask this question because there's always something that somebody, me and somebody for the audience, could benefit from. So thank you so much for that. So if for anybody that wants to connect with you, look you up, any of that stuff, where would you suggest they go?
Okay, so my website is www.askdrlola.com. Askdrlola.com. So under askdrlola.com, like it encompasses and embodies all the things that I do in terms of the health, speech, autism, in terms of personal development, self-mastery, in terms of tech for professionals. Then on Instagram, at Ask Dr. Lola. Instagram is at Ask Dr. Lola. Facebook is Lola Okeowo. That's my Facebook page. And yeah, YouTube. Okay, I have a YouTube channel. You type Autism Renewed, I have a YouTube channel for Autism Renewed. And I'm also on LinkedIn as well. You can find me, Dr. Lola Akio, on LinkedIn as well. Yeah.
Awesome. Thank you so much.
I'm on Threads too. Threads just came out. So I'm on Threads too at Ask Dr. Lola and Twitter as well. Even though I'm not as active, well, I hope to. to be more
You get in
active.
there,
And also
right?
get on TikTok if possible.
That's where it's going, right? So thank you, thank you,
Yeah.
thank you. Thank you so much. So, and then on the flip side, if anybody's looking for a great family medicine physician, we are accepting new patients at Apple Valley Family Medicine. You can call us at 304-350-1087. And you can also find us online at www.applevalleyfamilymed.com. Thank you so much. This was
So
great. So you guys
just
have
before I go, I wanted to give something to your audience.
sure,
So
sure,
just
sure,
you go
sure.
to autism, sorry, askdrlada.com/autism. So if you are someone out there, you need, clarity, I have a resource for you. And of course, I also do one-on-one consultation, virtual consultations. Sometimes some parents just they need a bit of clarity. They've been doing a lot of things. They just need to be able to, put some things together. So if you want you need some clarity, then you can book a one-on-one consultation. I also have coaching programs, and all that. But you can book a one-on-one consultation. You can also book my coaching programs. If you go to my website, you have all that, But I have a resource for any parent out there. Go to www.askdrlala.com/autism. Then I have books as well. One of my books is coming out, Building Language Through Play. It's
Nice.
coming out. It's already in the works, almost ready. And I have a toy guide. Like I was talking about play. One of the things I keep on encountering all the time, I have a lot of parents who consult that my child is hyperactive, just running around, you know. I don't know what to do. I just put them in front of the screen because I don't know how to engage them. I don't even know the right toys to buy. Even your child struggling with language delay, one of the things you can use is toys as tools. And one of the greatest things I've seen is parents don't know how to buy the right toys. Most of the toys that we buy are the wrong toy. When I ask, the toys we like, all the flashing lights and songs, they are the wrong toys, especially if we are trying to build skills in the child. So that's why, by popular demand, I had to write the toy guide. So in that toy guide, and that's for everybody, whether your child has autism or speech delay or any developmental issue or nothing at all, is a guide that will break down all the kinds of toys we have and how you can, and the skills that you can use these toys to teach a child. I have that. So, I have that toy guide. If you go on my website as well, it's there. And it will help every
Oh,
parent, because
the
it
toy
gives
guide
parents a
is
lot of clarity.
the,
Sorry?
the toy guide is on the website.
Yeah, toy guide is also on the website. The toy guide. Every parent, because a lot of parents, now they want to, you can use it as a guide. You want to go shopping, people reach out to me, okay, and I tell them, dude, and you are intentional.
Right.
So the kids are playing, but you can build cognitive skills, attention, focus, concentration, turn taking. You can use to build social skills. There are different ways you begin to build skills, because the concept when you have developmental delay is, what skills can you build in the child to overcome the delay? We don't necessarily outgrow a lower level of developmental milestone. No, we grow higher skills. Just like a child crawling, or cry. I'll use crying as an example. A baby cries for everything. A child does not outgrow crying. When people say my child is 4, the child should have stopped crying by now. No, we gain a higher skill. The child starts talking or communicating, and they don't need to cry. They can tell you, I want to eat, I want to go. So when it comes to developmental challenge, what you want to do is that, yes, the child might be delayed, but the concept is, what skill are you, because therapy is building skills.
Right.
So toys are one of the ways you can use to build skills in your child, but whether your child doesn't has developmental issues or not. Life skills, social skills, skills every individual will need to thrive. So that toy guide is something that has helped so many people, and the feedback has been amazing. So you
That's
can
awesome.
also get that. Thank you.
Right. You guys make sure you check it out. Even me, I think I'm going to be going there to get that for my patients. So you guys, thank you so much for tuning in. Dr. Lola, thank you so much. Have a
Thanks
wonderful
for
day.
having me.
Thanks. Bye.
You too. Bye.